This thing is not up. Here we are. What's up, everybody? Welcome back to a special edition. Hi, Dr. Zakia. We are live, girl. Hello. You on camera, child. Let's look like you want to say hi to people. What up, everybody? Welcome back to another episode, a special edition of Angie's World Podcast. Today, there will be no interview because we are in a state of emergency. I wanted to make this episode. So thank you guys for being here. I have my boy Kev in the building, my co-host 950 Kev. What up, Kev?
Good morning, everyone. How's everybody doing? As I always
Good
say,
morning.
any day above dirt is a blessed day.
Absolutely. Kev is a little tired today, y'all, because we going early. Tell him what you did last night, Kev.
Now, I ain't gonna tell him everything I did, but I was at obviously his football season's back, and anybody who knows me knows I'm somebody who's played. I'm a big fan, so I was in New York at the Jets green and white game, and obviously had some soda pops afterwards. But I'm here for a very important topic.
Thank you so much, and thank you for being here. We have Dr. Zakia in the building once again. Dr. Zakia, she probably been here about 6 times already. But thank you so much for joining me, Dr. Zakia. Hello?
Oh, you want me to do a little intro? Hey, everybody. It's Dr. Zakia. I can't wait to get this discussion popping because, everybody's been asking me what I think about monkeypox. So thanks for the invite. And nice to meet you, Kev. What up?
Pleasure.
Here's Lala. Hey, Lala.
Hi.
Hey, Lala. What's up? Thank you for joining us. Listen, there's a reason why I have each of these people here to discuss the monkeypox topic. Y'all already know Kev, 950 Kev. He's always joining me on my A-List After Dark. He's my co-host. He's also another radio guy. He has a lot of good journalism questions and a lot of questions to add here to the monkeypox situation. Obviously, you guys know why Dr. Zakia is joining us today. She is can you tell them your exact title? Your medical title, so they know.
Yeah, I am a family medicine physician. I'm board certified in family medicine, and I've gone to just to give you an idea of what that means. That means I went to med school. Then after med school, I completed a residency, and then after I completed a 3-year residency, I took all the required exams to have a license and have a certification and say I can be here. I'm Dr. Antoine.
So. Absolutely. So she is a real medical doctor, y'all. Yeah. And for those of y'all that's missing the live, you can always come back to the YouTube video and ask questions in the description, and we will definitely try our best to answer it. But we're trying to, answer as many questions as we can today about monkeypox. And we have Lala joining us. Y'all seen Lala before. She's been around Angie's World for Hot Topics. And Lala works in a lab. Can you tell them exactly what you do, Lala?
Yes. So I am a molecular biologist, and I study or I research retroviruses, lentiviruses, which is in association with HIV/AIDS.
Yes. So absolutely. So there is a reason why each of the people are here today, and we are gonna, everything
big
you
brains.
Need. Absolutely. We have
someone we colored too.
Absolutely. Black doctors, Black scientists, Black journalists. We're all about that right now and forever. So it's very empowering to have you guys here. I'm so happy that you guys are here. And the main reason why everyone is here is because I want to cover everything about monkeypox, and here's what you need to know. A lot of times in our communities, they have like a false kind of idea of what it is. They hear myths. Some people are getting their information from the Shade Room. Some people are getting it, not to say Hollywood Unlocked, the Shade Room. I mean, those are great publications, but I wanted people to be able to come in here and ask questions directly to a doctor, to a biologist, have a lot of the myths debunked, and for us to kind of just cover everything you need to know about monkeypox. So without further ado, Make sure that you guys subscribe to the channel, y'all. Okay, this is real conversations with real people. This is no gimmicks right here. Please give it a like. Please share the video. Please subscribe to the channel. Make sure y'all hit up Kev. He's at 950 Kev. We got Dr. Zakia in the building. You can follow Dr. Zakia at Dr. Zakia Antoine. I'm trying to show her little banner right now. Dr. Zakia Antoine in the building. Y'all already know. Follow her. Her stuff is going to be in the description. We got at 950 Kev. Make sure y'all follow him and lock in. And then we got Lala's Lab, baby. We got at Lala_MEILE. All right. So the first thing I wanted to talk about is what is monkeypox. Okay. So I'm going to just give people the definition of what monkeypox is according to the Department of Health. All right. So monkeypox is a rare viral infection that does not usually cause serious illness. Okay. However, it can result in hospitalization and death. That's why health officials in New York and the US and around the world are monitoring cases of monkeypox in areas that do not usually report monkeypox infections, including New York State. Right? While New Yorkers should not and people should not be alarmed, everyone should stay informed about monkeypox. And this means understanding the symptoms, how it spreads, and what to do if you are exposed. Okay. So, Lala, I want to go to you first. Tell me a little bit about why you said to me the other day that you believe that monkeypox is HIV 2.0. Explain a little bit about that.
Yeah, so I took some notes because I knew you were going to go there with me. Okay, so monkeypox, from what I understand, is an orthopox virus, right? It's a genus of viruses in the family of Poxviridae and the subfamily of Cortopoxviridae. I know y'all don't really know. You might know Dr. Antoine, but I'm going somewhere, right? And most famously under that, genus of viruses is the variola virus, or what we know as smallpox, right? Okay, cool. So where did they initially find smallpox?
I don't
Central
know.
and West Africa. I'm going somewhere. And then under smallpox, they have these glycoproteins that are, one of them in particular is also in the same, it's in the same series as HIV, and it's called glycoaminoglycans, right?
Mm-hmm.
With that, and they abbreviate it to GAG or GAG.
Got it.
So with the GAG, that particular protein is what helps copy and mimic the virus and also to infect upon other cells.
Ooh.
See what I mean?
Yeah.
Okay, so if we go through the history of AIDS, it also originated in Central and West Africa.
Mm-hmm.
But it was also found in non-primates, from what I understand. However, it has the difference between the two is one is RNA, it infects through RNA, and the other one infects through DNA, right? But they still have that glycoprotein that mimics the same thing. So when we were discussing the symptoms, that's when my gears started turning, and I'm like, there's something going on with this, to where it's oddly similar, because I remember I wasn't alive, but my previous research about HIV was, from what I understood, it started with the sarcomas on the skin. They called it something else. The name eludes me right now, but I'll find it in a couple of minutes.
I've seen pictures of it.
Yeah. But the original name, they called it like the gay cancer.
Mm-hmm.
And then they had like another name for it before they actually came out with.
I think it's
what it
GRID.
is.
GRID you're talking about. Something
Yes,
immunodeficiency, something.
Exactly, because it was affecting the immune system.
Yeah.
So they thought. And that's where immunology was born. But from what I understand with this monkeypox actually was discovered in 1958.
Okay.
and then there was a small outbreak in 2003, and then now they rebranded it to say, oh, it's 2022, don't touch anybody. So from what I was telling you personally, like, you know, on our one-to-one discussions, what I was telling Angie was, I said, think about it when it was GERD, right? They didn't want to upset the communities. They, you know, they didn't want to have any type of backlash or discriminations against a certain group of people. But it's oddly similar to what was happening in the late 70s and early 80s, right?
Right.
They called it something else. Then they said it's only affecting a certain community, which is still the gay community or gay men. And then they had all these lesions, which they initially thought was cancer. Then it was, you know, oh, don't have sex with anybody, don't touch anybody, don't do. So that's the reason why I said I felt that it was, they're not in the same family, they're not in the same genes, but they mimic the same symptoms, and it's very concerning.
And explain, Lala, to the people why exactly it's concerning to you, because a person that is not studying, for those of y'all who is just locked in, thank you for joining me. I have Dr. Zakia here, who is a medical physician, licensed doctor. We have Lala, who is she studies viruses. She works in a lab. She's definitely a biologist. And tell us a little bit, Lala, why it's really concerning to you that this virus mimics a little bit of what was happening with GERD and the HIV. Was it called GERD? What'd you say it was called?
Yeah, it was called GERD at first.
Yeah. How come it's concerning to you? Do you think that it's going to continue to evolve and multiply, like kind of?
Yeah, I mean, but that's what viruses do, right? So if you think of it like you have your cell phone and you want to upgrade your cell phone, or update the software, right? That's what the virus is. It's a software upgrade. So already in those, you know, in those proteins, they already have the original coding.
Yeah.
So it's just upgrading itself to something more virulent, and that can kill you even faster.
Okay, I hold that thought, because I want to go. We're going to talk about, you know, vaccines, who should get it, who's at risk, and different things of that nature. But if you're just tuning in, we explained, you know, what monkeypox was. I'm going to explain it one more time for the people who may have missed it. The clinical definition is monkeypox is a rare, according, and my information is coming from the Department of Health. So monkeypox is a rare viral infection that does not usually cause serious illness, okay, at the moment. However, it can result in hospitalization and death depending on your immune system, okay? That's why the health officials in the United States and around the world are monitoring the cases of monkeypox in areas that don't usually report monkeypox, which is, you know, New York. And, you know, that's why they declared it a national emergency, because of the way that it's rapidly spreading. Okay. They're telling people not to be alarmed, but everyone should stay informed. Okay. You need to understand the symptoms, how it spreads, and what to do if you're exposed. Dr. Zakia, who is at risk of contracting monkeypox? Okay. Because right now there's a myth saying that, you know, this is a gay disease or this is a STI. So do you want to break down to the people a little bit who is at risk of catching it?
No, you can catch it if you're exposed to it. Like it's transmitted through close contact with the infected person or animal, or with a material that's been contaminated with the virus. So pretty much, if you know you've been around it, you can contract it. Like if you touch it, or any of the droplets, like if somebody I guess had like any like bodily fluids that touch the lesions and it touches you, you can transmit it that way. So that's where I guess the STD thing is coming in, because the source can appear anywhere. So it's not like it's just like gonna focus on just like, I think, one population of people. Now certain disparities in medicine can make it appear that way. Like if like Black and brown people are getting this, and it might have something to do with just access to care or what's going on with the medicine in that area, not necessarily the virus itself. So
go ahead. I'm sorry.
No, I have a question. Now,
Mhm.
obviously, when you talk about dense populated cities like New York,
Mhm.
LA, Chicago, people are moving around. We've just we're still in a pandemic, but we've kind of at least trying to get back to some type of normalcy, whatever that means. When you
Mhm.
talk about contact with monkeypox, if people on the subway or people in an office in an elevator, is we know about touching the lesion, the actual infected area, but let's say a piece of hair or somebody brushes off on a non-area that's not infected. Is that also something that we should worry about? Where if you're on a in a subway or on a Dunkin' Donuts and somebody happens to brush by you, if they're affected, but that area that touches you or grazes by you is not the affected area, is that something people should be alarmed about?
Well, I mean, it's all cause for concern what you're exposed to, because when people think of pox, they think of like chicken pox,
Right.
or one that everybody really got when we were younger, is like molluscum contagiosum. The little warts you would have when you play in the playground. That's a pox virus too. So
Mhm.
typically
And
you have
people
to
can
touch.
people could catch that too with as a STI, the molluscum thing.
Yes,
That
yes.
people could catch that on their vaginas or their penises. But go ahead.
Yeah, especially if you see it in little kids, you always suspect sexual abuse, like the molluscum contagiosum. But more so, I brought that up because they're all transmitted the same way. Like the genetic material or material inside of the lesions are very contagious. So if someone would if their sores are oozing, and they're touching stuff, and you touch that, you can get sick. Like you say, if you
Right.
go and touch like a contaminated area on the subway, and then you're rubbing your skin or putting your hands in your mouth, or you
Right.
can contract the virus that
Right.
way. So I would, definitely use contact precautions when you're out in public. Like that's why you want to always wash your hands. If it's a
Yep.
public area, have like wipes.
Yep.
Wipe stuff down if you're going to be touching it, or you're sitting there or eating your food there. Because I've started wiping stuff down when I get on my seat in the airplane. I wipe everything
Yeah.
down with Clorox wipes.
Right.
Um,
Is
things
it
like that.
is it a situation of like obviously we've heard with COVID,
Uh-huh.
it's very highly contagious, so it doesn't have to be a long contact period. With monkeypox, is there a situation where it can be instantaneous, or is it like you have to be
It is an
around this person?
incubation period. It is an
Okay.
incubation period.
It's
I
10
think.
to 14 days.
Yeah.
But from a contact perspective, that
Yeah.
means if I'm around somebody who's affected for 2 seconds, that can affect me, or is it? Do you
It
have to?
can. Let me give you an
Okay.
example.
Yeah.
I had a colleague of mine, and he was just talking about this on social media. He had a young kid, and he contracted monkeypox from the gym. They already isolated where he was exposed to it.
Mm.
So touching equipment in the gym, and he came in. He had like a flu-like illness and a rash. The rash was not bad. He's doing well, but it was important to come up with a quick diagnosis, and then like get an idea where he got exposed to it, so you can decrease other people getting the virus as well. So they were able to let everybody in the gym know, hey, go get tested if
Right.
Mhm.
there could be a possible monkeypox outbreak. So I mean, you definitely have to be mindful of what you're touching. And then if you're feeling some of the other symptoms are just like lymphadenopathy. So what that means is your lymph nodes get swollen and tender, and just feeling tired. How you feel achy when
Like
you
a flu.
when you're
Lethargic.
coming
Yeah.
down with
Yeah.
something.
Hmm.
So go to the doctor, get checked, so you can protect yourself, protect your family.
Right. No
Hmm.
doubt about it. So, is there a difference in the early stages between, like we've heard with COVID, like
Mhm.
people said people still catch colds. Like anybody who starts coughing and sneezing. I was at a football game last night.
Mhm.
Somebody sneezed. I'm like, oh my god, we freeze, right? But
Hold that thought, Kev.
yeah,
Before we're
okay,
gonna get to that, I just want to recap, for y'all. So real quick, we're gonna go into the symptoms of monkeypox, but I just want to go into again, just to reiterate, who is at risk of contacting monkeypox. Everyone is at risk of contacting monkeypox. It does not matter your sexuality. It doesn't matter your gender. It doesn't matter your age. Anyone can catch monkeypox. Okay. They're saying, however, based on the current outbreak, certain populations are being affected by monkeypox more than others, including men who have sex with men. Okay. And the reason why that is happening, and this is, I believe that it's happening this way. Again, I am not the end all be all, but the reason I believe that it's happening more with men having sex with men is not because men that have sex with men have anal sex, because heterosexual people have anal sex as well. So it has nothing to do with the way they're having sex. I believe that it's rapidly spreading in that community because from my experience, and again, I want to say from my experience, I'm an LGBTQIA plus, I don't want to say liaison, but I'm an ally to them. I have family that's gay. I have friends that are gay. In that culture, I've known them to be in that community very free sexually, multiple partners, orgies, different partners every day. So I think because of that, not to say that heterosexual people are not swingers, are not non-monogamous, but I do believe that from my experience, what I've heard in the gay community, the partner switching is more frequent. The orgies are more frequent. They're more free. So that's why I believe that it's spreading rapidly. I don't know if Lala or Dr. Z has a more clinical answer. If you guys have heard in the lab or maybe in the hospitals, why it's spreading more with men on men. I don't know if you want to elaborate on that, but that's my theory, because the gay community is a little bit more open with swinging and having more multiple partners.
Yeah, you know what? I got nothing for you. Like, you know, I know I've learned in medical research, like you can have things that are related and we don't really have an
Right.
answer for everything. So it may be with some of their practices, it might be something else, you know, and we would have to probably do you know, some type of
Study.
yeah, to see. And you know, once the numbers link these two behaviors together, then we could say, well, this, you know, if A then B, you know.
Right.
So I don't like to,
I mean, I gotta believe
Generalize.
yeah,
just like any other disease, and you know, Lala mentioned this has been around, you know, for many, many years. Disease morph. There's got to be a reason, and I'm not a doctor, and leave that to Dr. Z, but there's got to be more of a reason than just being promiscuous, that this is
Absolutely.
happening within this community. So maybe there's a situation where this disease is morphed. It's got to be because heterosexuals are not maybe as active as you just mentioned, Angie, but heterosexuals are active too, where they're, you know, multiple partners, you know, non-protection, different things of that nature. Hell, even just dancing at the nightclub, from what you guys are saying, you can catch monkey.
We're gonna get to that too, and I'm getting
Right.
this information. The MSM, men that's having sex with men. I'm getting this information once again from the Department of Health. I am not making this up. This is what the
Right.
Department of Health is stating. Now they're saying also, they didn't say only men having sex with men. They're saying right now, based on the numbers, that is the community who I've heard are first for vaccines, and that it's, you know, the gay community is where it's spreading the quickest. Okay.
Right.
Now, based on previous outbreaks, again, this is from the Department of Health, because I want to make sure that everybody I want people to come to Angie's World and tune into this special episode. And, you know, I thank you so much, Dr. Z and Lala and Kev, for coming, because I want you guys to be able to get accurate information. If you tune into me, you know, sometimes people don't want to tune into the other outlets, but I don't want to report false information. So this is why I'm getting it from the Department of Health. They're saying based on previous outbreaks of monkeypox around the world, some groups may also be at heightened risk for severe outcomes, okay, if they contract monkeypox. Now that includes people with weakened immune systems, elderly people, young children under the year of 8 years old, and pregnant people. Because when you're pregnant, when you're a child, when you're a senior, and when you have a weakened immune system, anything that your immune system is lower, so anything that comes into your system is going to be harder to fight, which is why there's been hospitalization and deaths regarding these monkeypox cases. Quick question, Lala. I want to just ask you your opinion. Why do you think that well, now they're also saying that black and brown people are being more, I guess you can say, affected from this disease, and men having sex with men. Why do you think it's tailored to just those groups right now?
Oh, that's a really good question. The only thing that I can honestly think of, I think I don't want to say your theory is spot on about the gay and bisexual men.
And again, that's my theory, y'all.
Yeah,
Like I said, I don't know.
But what I
Right.
will say is it makes sense.
Mhm.
However, with the black and brown community in totality, I think it's because we're more susceptible to things like diabetes, things, diseases along that nature that also suppress the immune system to a certain extent, not entirely, But they said the same thing with COVID. If you had certain, health issues like asthma, diabetes,
Yep.
lupus, rheumatoid arthritis, anything that suppresses you, you'll be more susceptible into catching the disease. So I think it goes along the same lines, and that's just I think it's just tailored to individuals and not like a whole group. I don't think that's fair to say, but I mean, because there are other groups that could have diabetes as well, and they could catch it just as easily or easier than someone that is in like pristine health.
Absolutely. And they also said that New York is the epicenter. And this information that I'm getting is from the Citizens app, which they work directly with the World Health Organization and the Department of Health. The Citizens app has said New York City is the epicenter of monkeypox right now. We were one of the first people to declare a state of emergency. That is the obvious reason why. We were first. LA, New York, California was second. And then, the bigger cities were third, fourth, and now it's a world thing. Of course, New York is the epicenter of monkeypox outbreaks. We are 10 million people just in the 5 boroughs. That is the same thing that happened with Corona. Once New York gets something, it's going to rapidly spread because we are on top of each other. And unfortunately, in quote unquote urban communities, especially in New York City, when you have 500 black and brown families in one building, never mind the subway station, the thousands of people that you encounter every day at your job, on the subway, and just around, it's going to spread in more inner city communities. It's not that some lack healthcare because some people don't have insurance, but it's just the density of the population. So when they said that New York was the epicenter, I said, well, of course, we always are. The same thing happened with COVID. It's just too many people. So, that's why I wanted to go over, some of the myths about, is this just a gay disease or can we not get it and who is at risk for it? Everybody is at risk. If you guys see me going like this, I don't have a drug problem, y'all. It's just dusty in here. So.
Can I say something to that?
Absolutely.
Yeah, no, they said the same thing like about AIDS, right? They tried to say that it was like a gay disease. No, it's an everybody problem. I mean, even in the early 80s, there was I think she was lesbian, but she wasn't having sex with men. So how did she get it? Like it's been so many cases where you can just debunk that myth of it's only catered or only targeted to a certain demographic. This is like a world issue, because just last week there was a woman who contracted monkeypox. So I don't think she falls under that characteristic of gay men if she contracted it.
That's so true.
That's just
everybody is at risk. Absolutely. Did you have something to say, Dr. Z? You look like you wanted to talk.
No, I'm just like, with things like that, I just know from like my training in epidemiology, like when you just run stats and you look at like overall counts of like who's getting what, I mean, it can make you believe things that you just know are ridiculous. Like, for example, like more people drown in the summertime, but because I go eat ice cream, that mean I'm gonna drown. But No, it's because it's summertime and more people go swimming in the summertime. That's
And
why
more states that have winters is summertime and identical in all 50 states or whatever the case may be, except for Alaska. So obviously more people are going to drown in the summer because the weather is warmer.
Yeah, so I mean, it's just things like that you have to be careful because I mean, is it significant? Maybe. I mean, and yeah, you're right. I think some of the sexual practices of that community, it does, it will show up there because
Escalate.
they're getting exposed to the lesions, though. You know, like but anybody having sex with someone who has lesions on their genitals, you know, can get exposed to it.
And we're going to go into how it spreads real quick. But like Dr. Z, I think Kev was asking her, what are the symptoms? We'll go more into like the symptoms and stuff. But according to the Department of Health, the symptoms of monkeypox can include, and like Dr. Z said, anywhere between 7 to 14 days after you've been exposed, right? You can have rashes, bumps, or blisters on or around the genitals or in other areas. And we're going to go into why the genitals. You don't necessarily have to have sex with the person. It could be close contact or cuddling, but we'll get into how it spreads in a second. So if you guys have any rashes, bumps, blisters on or around the genitals or other areas, like your hands, feet, chest, or face, and some people can have flu-like symptoms such as fever, headache, muscle aches, chills, and fatigue. These symptoms may occur before or after the rash appears or not at all. Okay, so you could be feeling fine. You could be feeling fantastic, but you may have some rashes, bumps, or blisters. So definitely keep an eye out for those things, because those could be some symptoms of monkeypox. Okay, so now I guess we could go ahead. I'm sorry, Kev.
So again, obviously I'm in that boat. For the person is like the hypochondriac and everything like that, which is me, right? I'm the Black Felix Unger. I'm like, you know, trying to stay clean and neat. What's the difference between if somebody has eczema or somebody has poison ivy or somebody has a summer, you know, itch? Is there a difference between these rashes, or is it a situation where like there's no real difference because they're skin lesions and anything that you get that doesn't look right or you can't identify, you should think, hey, maybe this could be that and get medical attention? Because I think that's the issue for most people when we get these thoughts. Like they go, oh, okay, it's a gay disease, I don't got to worry about it. But we know that's false, right? So is there any way people can identify things so they're not just saying, you know, I'm self-medicating, I got a little fever, I had too much to drink last night, I'm not feeling well, and equate things and not really think about the signs of monkeypox, if that makes sense?
Yeah, I mean, the rash is distinctive. I would say that. So, I mean, number one, you know, don't go and Google stuff. That's what I'm a caution the general public against. I just really averted a family crisis with my family. I'm a doctor. I'm a licensed boarded physician, and they didn't even want to ask me stuff. And they, you know, had a family member really in a bad situation. He wound up having emergency surgery, and I kept telling them bring him to the emergency room.
Right.
So don't Google stuff and think that you know what's going on. You know more than a physician. Let someone go and look at the rash, and then just because it's not monkeypox doesn't mean it's not something else. Right. These rashes are similar to syphilis, other, you know, STDs like the herpes virus, chancroid. It definitely looks like a wart, or it can look like a big like pimply thing that's umbilicated, like molluscum contagiosum as well.
It's like a blister of some sort.
Yeah, and then you see the people, some of these severe cases that you're seeing on social media, I think they're exceptions. They're not common. You know, they're looking like boils and really serious.
And big cauliflowers that spread open with a black thing in the middle. I've seen some things. They had some girl that
secondary syphilis. That's what it's looking like.
Right.
Yeah, I saw a girl and a guy like kind of like document their story from day 1 to day 12 and how they progressed, you know, how these boils and pox kind of spread. See, the difference is like with the molluscum, it's almost like, from what I've read and researched, you can remove those. Like you can, like, they're like these pearl looking bumps with like a dimple in the middle. and you could get them cut off or lasered off at the doctor, and it can stay in your body for like on and off for a year or two. But it's not like monkeypox where you can get fevers, you can be hospitalized and different things like that. I think, and Dr. Z can correct me if I'm wrong, with the molluscum, it's more just like stays on the surface of the skin. It's not a virus that's kind of like causing fevers and flu-like symptoms and hospitalizations and different things like that, right?
Not typically, no. But like,
so that's like one difference.
Yeah, but I guess why I brought it up is just because it's in the same virus family, and then you're seeing it in the same group of people you're talking about, like it's treated as an STD, and also you have to apply like the patient history with their complaint when they come in. So if I know someone has a history of like, maybe being promiscuous, not just being gay, and then they come in and they have sores around their genitals, I'm going to test it for a number of things, not just monkeypox, because it could be something else. You can't just anybody come in with a sore, like just put them in that. And so
you are right, because even with the molluscum, if a person I read has HIV or cancer or anything, molluscum can take you out. Oh yeah, so you're right.
So you want to get the right diagnosis. So that would be on my like what we call a differential diagnosis list, and then we just kind of we rule things out from there. So that's the only reason why I brought it up, because I think the source can be confused with it, and then also in kids it's considered like a STD as well. But you can get it from just like playing in the sandbox with somebody who has it, because kids, they put everything in their mouth and touch. They want to hug each other and everything. So you'll see it like in that group of people as well. So the thing also with the fever though is similar to smallpox. That's where the fever, but it's not as serious as smallpox.
Would you classify like herpes, shingles, monkeypox, smallpox, and molluscum all in the same category?
No, because they're different types of viruses, and that's where Lala will probably start. I see her shaking her head.
Go ahead, Lala. What's the difference?
No, they're different type of viruses. Because the smallpox, I think they're more of a zoonotic. They fall under the zoonotic family. They're more DNA type.
Yeah, monkeypox and smallpox are double-stranded DNA viruses. So
yeah. And
what
then
that means is they're
RNA. It's okay.
No, what it means is when they cut, because what the single goal of a virus, once you're infected with a virus, is to replicate itself and lyse your cell and spread to your other cells, so these pox viruses, what I want you guys to understand from in the virus world, they're huge. They come with everything that they need to reassemble themselves, and like basically they take over your cell machinery and use your ribosomes and everything to manufacture everything they need.
And they make their own DNA.
Exactly. So the pox virus comes with everything. They don't even really have to make much. And then they just come and take over your cell, evade your immune system, lyse the cell, and they spread. Whereas like a virus like
HIV and
it works completely different.
So I guess my question again is I'm sure some people have the same thing. What's the difference between monkeypox and I guess shingles and herpes? What's the difference?
The way that they infect.
That's number one. And then number two, if you can eradicate it from your body. Because something like herpes, it stays there. It's what's called a latent virus, and it can reactivate. That's why like you get herpes outbreaks like, periodically, because you never get rid of it. Monkeypox you can get rid of.
Yeah.
Okay. Woo. Okay, guys.
Make you want to just stay in your house and lock the door.
I mean, that's what
I'm having PTSD right now. I mean, not PTSD. I'm having, what is it called? Traumatic stress disorder. But anyway, go ahead. Go ahead, Lala.
Mike, you need to turn the lights on. I'm calling you Mike. Kev, you need to turn the lights on before you have sex, so you need to examine the genitals.
Y'all better put on that flashlight and get to looking.
If it don't look right, be like,
ladies, if it don't look good, I'm out. I'm out.
Ooh, child. We're gonna go into how it spreads real quick. All right, so now we're gonna get into how it spreads according to the Department of Health. All right. But before we get into that, brief commercial. Make sure y'all subscribe to the channel, www.youtube.com/Angie's World. Please subscribe to my channel. Please thumbs up the video, because thumbs up in the video and sharing the video is going to get it to more people, so more people could be helped, so more people could be informed, so more people can know everything they need to know about monkeypox. Please follow Dr. Zakia on Instagram at Dr. Zakia. Her stuff will be in the description. Please follow Lala on Instagram at, I have her stuff in the description because I don't remember off the top of my head. What's your Instagram, Lala?
Lala_Melee.
Lala_Melee. Make sure you follow 950 Kev at 950 Kev. Tap into what he's doing at 950 Lounge, his radio show and everything. Again, real conversations, real people. Thank you guys for watching. Thank you guys for being here. And now let's go into the next half of our conversation here. All right, guys. How does monkeypox spread? All right. According to the Department of Health, monkeypox is spread through close physical contact between individuals, okay? This includes direct contact with monkeypox sores or rashes on an individual who has monkeypox. That's what Dr. Z said before, okay? Respiratory droplets or oral fluids from someone with monkeypox, particularly for those who have close contact with someone who are or around them for a long period of time, aka saliva. Are you tonguing somebody down? They have the virus. That is included respiratory droplets or oral fluids, okay? Now, your mouth is an oral fluid. Respiratory droplets, everybody knows what that is. If you're coughing, spit comes out, sneezing, spit comes out, snot comes out. Those are droplets and respiratory fluids, okay? It could also be spread through contact with objects or fabrics, okay? Example, clothing, bedding, towels that have been used by someone with monkeypox. You coming out the pool, you drying off, all right? You're at a pool party. You came out, you took somebody's towel, you dried off. Oh, shit. You know what I'm saying? This is not my towel. You know what I'm saying? You could get it like that. You coming out the pool, y'all sharing towels. You go to the gym, you sharing towels. Make sure that, you know, if you're going to a public pool, you have a towel that's not a common color, like an orange or a lime green or something that you could identify. I got you. I see you. You want to say something, Kev, but hold on.
Yeah. Okay.
Hold on one moment. I got you in 1 second. Make sure, you know, laundry and stuff like that, you're doing your laundry actively, you know what I'm saying? Just to, you know, make sure that your clothes are cleanly. You're not sharing, you know, intimate products with people like washcloths and stuff like that. You're not sharing toothbrushes. You just want to have, you know, regardless if that's your partner or not, because at the end of the day, people who you live with could come bring stuff to you. So if you're in the habit of sharing towels and toothbrushes and stuff with your partner, I think at this time you need to just have your individual stuff. If you're going to public pools or gyms or anything like that, make sure you guys are wiping down the treadmills. Or the machinery that you're using. Make sure you have a towel and stuff that you could identify. But Kev, I think you had a question.
Yeah, two things for Dr. Lala, anyone can answer. With the sprickets, right? Saliva, fluids. Is that has, like Angie mentioned, what she mentioned has to be over a course of time. Now, somebody sneezes or coughs, that's not over a course of time. Is there a difference in that? Because it's just a quick sneeze and, you know, maybe they didn't cover fast enough. And also with towels and objects, sheets, pillows, things like that, what temperature, because people travel, we see people all around flying, like you mentioned, you wipe down your plane seats, but the hotels and different things like that, Airbnbs, is there a certain temperature people need to wash their clothes in, or just any hot water and detergent will, you know, qualify to kill the virus in a cleanliness form? First, I guess the sprickets, and then the towels and sheets and things like that.
You go first.
Well, I mean, with the respiratory particles or the droplets, they're saying that it requires prolonged face-to-face contact.
Okay.
So, like just someone, I guess, you know, sneezing on you,
Right.
It's a low risk.
Lower risk.
But
Okay.
if this is somebody that you're like, let's say, you know, someone that you live with,
Right,
like your, you know, spouse or your family member, whatever, and they've been exposed to potentially, yeah, you can catch it from them because you're, you know,
Right.
prolonging, you know, you're in each
Yeah.
other's space.
period of time. Right.
over and over
Right.
again.
If you're sharing a bed and the bedding, things of that nature.
Right. Exactly. Another thing I wanted to add to what Angie was saying, just for information's sake, because people are listening, is that the virus can cross the placenta and be given from the mother to the fetus.
Wow.
So, and you can be born with congenital monkeypox. So I just want the expectant moms to know that, to protect themselves and, be aware that it can cross the placenta. So,
wow. So you can spread it.
And I guess the second part was like hotels, towels, sheets, pillows, touching remote controls, that type of thing. Is it just simple as washing down? Should we bring our own towels to hotels now and sheets? I mean, again, because the people traveling want to know that. Like when you use a hotel towel, we know those towels have been used by hundreds of other people and been cleaned. Should we use different towels? Should we bring our own towels? Your thoughts?
You shouldn't have to, but I've seen some stuff that make me kind of like leery. So
right.
I feel, but typically, you shouldn't have to. I have not heard anything about the virus being particularly hard to kill, like from wiping down stuff that is resistant to, being, disinfect regular things you do to disinfect things.
So it's not a hard virus to kill if you're using like a Lysol or a
no.
Okay, good to know.
I think like right now they're thinking that we're seeing more cases of it because of waning immunity to smallpox, because smallpox had been eradicated, and they're saying the virus is very similar to smallpox. It's just not as severe. They've already developed like actually, I'm getting this from the World Health Organization. Like because I did a little bit of research after Angie asked me to be on the show today.
Thank you so much for being here, by the way.
Yeah. So no, basically, I guess to answer some of Kev's questions, like they're licensing some smallpox treatments to treat monkeypox. They've been approved for it, and then also some of the smallpox vaccinations could also provide immunity for monkeypox, and they're letting this be licensed to be used as well. So
we're definitely going to get into the vaccinations and what people think in a second for sure. I just wanted to add this to y'all to let y'all know, and I should probably I'm going to also post this on my Instagram, so follow me at Angie's World Podcast, because I'm going to post this picture that I found. Okay. And it's stop the spread, stop the stigma, know your risk. Okay. So basically it goes from green to yellow to orange to red. So it kind of tells you what is the most risky, the more risky, the possible, and the less risky. So what they're saying for most risky to contract this is direct contact with an infectious rash. Okay. Direct contact with infectious rash, scabs, or body fluids. Okay. Sexual or intimate contact. Please note that condoms do not protect against monkeypox transmission. So the two main ways that are the most risky is direct contact with the sores or sexual or intimate contact. Okay. So that's red. The next level is orange. They're saying kissing, cuddling, or dancing at a crowded party inside with a non-fully clothed person. So if they're half naked, you're inside. They're saying dancing at a crowded party inside with a fully non-clothed people, cuddling and kissing. That's the more risky. The possible category is sharing drinks, sharing a bed, towels, or personal toiletry items, dancing at a crowded party inside with fully clothed people. So that's the possible. Now they're saying unlikely. They're saying dancing at a party outside with mostly clothed people. I guess they're saying outside because it's more ventilated. People could be 6 feet apart. It's not, on top of each other. Then they're saying unlikely, coworker to coworker transmission, especially if you're sanitizing, washing your hands, you're staying, distance away from your coworkers, you're not doing anything intimate with them. So it's unlikely. Touching a doorknob, trying on clothing at a store, traveling in an airport or on a plane, in a swimming pool, hot tub, or body of water, in public restrooms or public transit, at a grocery store or a coffee shop or a gym via the equipment. So they're saying that that's unlikely. But again, with the gym equipment, you want to just take basic precautions and also sanitize when you go there, and then the airports as well. So those are the
Work out at the
categories. What they're
park.
saying.
Go to the park.
Contradictory. I just heard a little bit of contradiction in that, because if you're telling me that if someone is infected and their lesion is also infected, and then they go to a store and they try on clothes, and then I go right behind them and try on the same thing, and you're saying that it can go from garment to garment, and you can be like, you just
I mean, if they're oozing, because the thing about it is they're saying it's possible but unlikely, because if you're infected with monkeypox and you're oozing with your blisters, most likely you're going to be quarantined. You're not going to feel wet. You're not going to be in a store trying on clothing and garments.
We like to think that, Angie.
Right,
Exactly,
but that's why they said, but that's why, listen, they didn't say it wasn't, they didn't say it wasn't possible. They said unlikely. The chances of you being at most risk doing that is a lesser chance than being at most risk of having sex with a person with these sores or kissing them. That's all they're saying. Right. They're not saying that you can't transfer it.
Degrees of right. Yeah.
They're just saying it's less likely for you to get it like that. So, yeah. I had a question though about transmission as well. Right now, listen, guys, I'm sad because y'all know, anybody that knows me knows I get my nails done faithfully ever since I was 15 years old. Shout out to Kat. Dr. Z has been on an episode with her. Respect the business owner. Kat at Kat Nail Factory. Follow her. I love her. She's been doing my nails since 2014. I haven't given my nails a break in a really long time. So for 2 weeks, for 3 months, I can't get my nails done, right? Kat said, leave them off for 3 months and don't put anything on them for 2 weeks, and then you can start putting medicine on. So she said you could go get a manicure. And right before I went to go get a manicure, I heard about all these TikToks, people getting petties and manis and contracting monkeypox from the pedicure spot and the manicure spot. Now I trust Kat and I trust her shop. You understand what I'm saying? And she's real, she's real clean and stuff like that. But when it comes down to like waxing, you know how you go get your waxes done on your face and your nails and your petties. What do you guys think about that? Because I just ordered a bunch of manicure stuff because I could go get my nails back again right before Thanksgiving. But right now I'm thinking twice of getting my manicures done. What do you guys think about that? With spreading in from hand to hand in the nail shops?
I'm personally not worried, but like I said, I trust my nail workers. Like they wear gloves and stuff.
You got to make sure y'all don't go to no hole in the wall nail spots.
Yeah, like they wear gloves, and then like there is like whenever they file my nails, like they have a file, like you get a little thing that they tear up and then they actually throw the file away.
Very good. Very good.
Yeah. So you have your own individual clean file. Like so you want to look for things like that. If they're not doing that, and it like because it was another place I went to in the past, they used to give you a file and put it in a box and give you a number.
Yeah, that's what Maria does. Shout out to Maria at Cat Shop. She does pedicure. She gives everybody, ever since COVID. Well, I don't know if she was doing it before that, but she gives everybody a little Ziploc bag with their own pedicure stuff that you got to bring to her every time you get your pedicure, and she uses your own things for the pedicure. Now, if y'all go to a nail shop, and I'm going to be 100% honest with you, there's a lot of nail shops, and I know a little bit about nails. There's a lot of nail shops that their only goal is to get asses in and out of the chair. The more asses that they got in and out of the chair, the more money is in their pocket. If you see that they concerned with getting asses in and out of their chair, get out of there, because these people aren't taking the proper sanitary precautions, because there's no way. And pay attention, after they finish with a client, are they asking the client to wash their hands before they sit down? And are they washing their hands? Because I've been in nail salons lately, and they tell the client, please wash your hands before sitting. Okay, but I didn't see you wash your hands. Did you wash your hands before I got here? So make sure that your person is washing their hands. Make sure that you guys are not going to one of those shops, those little sweatshop nail places that they just concerned about asses in and out.
That leads me to a question, right? And we see these viruses. Like we see in the reemergence of polio and smallpox. we know the viruses morph, right? And their job is to keep redoing themselves to be active. But when it comes to these viruses, is it because of behavior of society? Like, and I'm not judging anybody or any groups or anything, but is it because our behaviors and some of the things we do, we cough in our hands, then shake hands, we don't wash our hands properly, things that we do, is that the reason why these viruses keep staying alive? Or is it nothing, even if the most cleanliest person, if we were more clean as a society, can stop viruses from re-emerging? I mean, because I just feel like sometimes the things we do as people, if we were just a little bit more considerate, a little bit more cleanlier, thought before we did something, that we can control some of these ailments. Your thoughts, anyone, ladies?
Yeah.
I don't know. I don't know if it's necessary. I'm just going off of like what I do know and how they act. I don't know if that's like necessarily a major contributing factor, but I think that practicing good hygiene definitely helps a situation. It's not going to hurt it. But I mean, that's like I said before, that's what viruses do. They just upgrade themselves. Just kind of think of it like the Matrix with the Sentinels. That's what they do. They may lay dormant for a while and then just like, hey, did you forget about me? I'm back. Like that's their job.
Right.
But I definitely think, taking the OSHA protocols, hand washing, hand sanitizing, it stops it. You have these people that walk around, I'm an anti-masker, I'm an anti-vaxxer. Like they want some sort of, trophy for that. But then they get COVID 750 times. So one of my coworkers made a good analogy. He's like, if your house keeps getting broken into, what would you do after it's broken into the first time? Wouldn't you get a camera? So it's like, if you keep getting COVID and you keep getting all these things, why are you still running around an anti-masker, an anti-hand washer, an anti-vaxxer? It's like, obviously it's been proven that hand washing, hand sanitizing, cleaning, disinfecting, it's scientifically proven that it removes germs and kills germs. So why would you continue to walk around, I'm an anti-hand washer, I'm an anti-vaxxer, I'm an anti-masker? Well, if you want to be that, then just know that there's stuff out there. If you want to, touch door handles and doorknobs and hand railings and garbages and not wear your mask and continue to practice unsafe sanitary conditions, you're going to get sick, period. If you don't clean your house, you're going to get sick. If you don't wash your ass, you're going to get sick. Like, it's just literal simple stuff that it's like crazy. But I wanted to go in. I don't know if you guys had any other questions in regards to how it spreads, because I want to go. I'm not going to keep y'all here all day. Obviously we want to continue our Sunday. So we're going to get up out of here in a second. But I wanted to go into how to protect yourself before, all of us speak, or if, Kev has any other questions. I'm going to link all of this stuff in the description. Follow, and this comes from the Department of Health, follow reputable health information, including for New York, the NYSDOH, okay, the CDC, and your local county health department. Don't go to non-reputable sources for information regarding monkeypox and what's going on with this, okay? So we're going to go into how can I protect myself, then we're going to talk about a little bit about vaccines, and then we're going to get up out of here. So according to the Department of Health, they're saying people can protect themselves by taking simple steps, which are especially important for those who may be at higher risk for severe disease, including people with weakened immune systems. Ask your sexual partners whether they have a rash or other symptoms consistent with monkeypox. Okay? Avoid skin-to-skin contact with somebody who has a rash or other monkeypox-related symptoms. Okay? If you're exposed or experience symptoms, make sure to reach out to healthcare providers. Okay? Follow the reputable sources, like I said. So this is what they're suggesting. Are there any other ways that you guys, Dr. Z or Lala, want to give pointers on how to protect yourself?
When you go, some of the stuff you've already said, I would definitely when you're going in high risk areas, so that's like the gym or any like public area, shared area where people are touching things and using machinery or some type of device that's a shared device, I would definitely wipe it off before using it. Definitely wash my hands. I would definitely have conversations with, any intimate partners I have, like, are you around people? With me being a physician, I do a lot of work from home. I do telemedicine stuff. So I'm not like in direct contact with patients a lot. But if I were, that would be a discussion I have to have with my partner. Like, hey, I work at a hospital. Like, so when I come home, sort of like just, coming home and jumping on my man, maybe I need to take these scrubs off, throw them in the hamper, in the washer, take a shower, then, come and jump in our bed. You have to do things like that, I think, to protect yourself. And that's not unreasonable. As far as wearing masks for monkeypox, I don't think this is like now wearing masks still for COVID. That's a whole nother special. We could have another show about that. But I don't think you need to do all of that. But I think that's the main thing. And just being aware, of what's going on, like paying attention to what's going on in the news, because I feel like that's how COVID got to be such a big thing. People just kind of heard about it and they were like, oh, it's in China. The next thing you know, is here.
Right.
So if you just like brush it off as something that's insignificant and you don't care about it, it can become a big problem if we're careless. And I think you and Kev made a good point of that when you were discussing like is it people's behaviors that's bringing this stuff on, So I do think we have like a bit of what we call social responsibility, right?
Yep.
Like, to protect ourselves, protect the public, the people we're going to be around every day. So
absolutely.
I would also like to add that it's just like the little things that you do throughout your day. Sometimes my coworkers and I, we just take a second to just Lysol our desks. I know personally when I go to the restroom, I use 2 toilet liners. That's like really important because especially if it's affecting the genital area,
Absolutely.
And I'm not going to keep running home every time I have to go to the bathroom because my commute is 2 minutes. So
right.
If I gotta go, I gotta go. So
right.
I put the toilet liners. I definitely wash my hands for more than 30 seconds now. I mean, that's, but yeah, definitely just, personal responsibility so that socially we all can be responsible of staying clean and healthy.
Absolutely. What should I do if I was exposed or have symptoms consistent with monkeypox? Okay. So people who experience, again, if you guys are just tuning in, we have Lala who studies viruses. She's a scientist. She works at a biological lab. We have Dr. Zakia, who is a licensed clinician, doctor, practices medicine. We have Kev here, my co-host. You already know who he is.
Avoid viruses.
Absolutely. Yes. All right, y'all. So what should I do if I was exposed? What do you guys do if you were exposed or have symptoms of monkeypox? Okay. So, all right. People who experience consistent symptoms with monkeypox, such as characteristic rashes, lesions, should contact their health provider for a risk assessment. Okay. This includes anyone who traveled to countries where monkeypox cases have been reported or has had contact with someone who has similar rash or received a diagnosis of subjected or confirmed monkeypox. Now, the reason why it's very important also to go, as soon as you see something that you think could be monkeypox, a person that I knew, I'm not going to say who it was, somebody that I know recently in my life, they had some sort of redness and swollen, like not rash, not blister, but it was on their finger. And it slowly progressed and it got bigger and bigger and it blew up. And this person went to the urgent care and they found out that they had a staph infection in their finger of it was called MRSA.
Yeah,
and
the insulin-resistant Staphylococcus aureus.
Absolutely. So what happened was this person was operating a sledgehammer. And I guess, it's important for you to sanitize things in your house, including your garage. We don't know what type of germ, what type of, thing was on that sledgehammer. And it had like a friction with the person's hand. And that's how I guess maybe the virus was able to get inside. And had that person not went to urgent care, that MRSA could have traveled throughout their body. This person was hospitalized. They had to continue to get the finger drained. It was this whole big thing. So again,
MRSA is
please.
more of a bacteria,
Right.
It's not a virus. But
Right.
yeah,
Okay.
right.
Yeah.
The
Bacteria.
the
transmission.
correlation that you're making, yeah, that's very true.
That's why it's very important to clean even your house, your garage, things of that
Right.
nature, because stuff like that can have bacteria or different things on the surface. Okay. So, are there treatments available? I want to get into this real quick. We're going to get into the vaccine talk. Okay. But I just want to say real quick, antiviral medications exist, okay, to treat monkeypox, which may be appropriate for some people. Vaccines exist that can help reduce the chance and the severity of the infection in those who have been exposed. People who develop a rash or skin lesions should be sure to keep the rash areas clean and dry to protect against secondary infections. Be conscious of sun exposure to avoid discoloring exposed lesions. So we're summertime now, so you want to keep those lesions out of the sun. Talk to your healthcare provider about over-the-counter oral antihistamines and topical agents such as calamine lotion, cortisone 10, petroleum jelly, and iodine cream or gels, and consider over-the-counter stool softeners to help reduce perianal discomfort. So if you have something that's around your anus, you can have some stool softener so it won't be painful when you use the restroom. Okay? So anyone that is experiencing a painful rash or skin lesion, contact your health advisor. Prescription medicated mouthwashes and topical gels can provide pain relief and keep the rashes and lesions clean and are widely available. So make sure you guys tap into that. Why are health officials concerned? Okay, health officials are concerned because monkeypox is spreading and cases of monkeypox are presenting in ways not typically seen in past monkeypox outbreak via what Lala was talking about. Although the current strain of monkeypox that is circulating in the U.S. is rarely fatal, symptoms can be extremely painful and people may have permanent scarring resulting from the rash, which, any type of acne, blisters, anything like that can result in scarring. All right. So what is the world doing to help? They're in partnership with local and federal public health authorities. We'll continue to learn more and communicating openly with the public. Okay, here's another thing. Why are cases classified as confirmed orthopox virus / monkeypox cases? What does orthopox virus have to do with monkeypox? Specimens from suspected. You want to go ahead? Go ahead, Lala.
So orthopox is the genus of which the monkeypox falls under. So if you go back to like 5th grade science, they'll say, okay, you have a genus, a family, and a species, right? It falls under the same category. That's how viruses and bacteriums work. The genus is like the overall, and then the family is like which they fall under, and then the specific species. So that's how they break down different things. So it is an orthopox virus. That's the genus of it. So that's why they say that.
Okay, thank you so much for clearing that up. All right,
Ding,
y'all.
ding.
Absolutely. If you just tuning in, we have Dr. Zakia here. She is a medical doctor, licensed in several states, able to practice medicine. We have a biologist here, which is Lala.
Molecular.
Yes, just explaining to us what the difference was. We have Kev here, co-hosting. Before we get up out of here, you guys could watch the reruns. This is everything that you need to know about monkeypox. I think we've gone through everything. The last thing I want to talk about is vaccinations. And then of course, if Kev has any questions, we could plug whatever we want. But Dr. Z, I'll go with you first. In regards to these monkeypox vaccinations, what do you suggest? Do you suggest people get vaccinated?
From what I'm looking at, like with the vaccinations, it seems like the smallpox vaccine provides like 85% effective against monkeypox. And I mean, I feel like smallpox has been all but eradicated. Like when you see it now, it's like somebody trying to weaponize it. Like it's not even naturally occurring. And this is like like way less severe than smallpox. So I'm probably gonna skip this vaccine. I don't think it's necessary, and I think the reason why, and actually this is what the World Health Organization is thinking. The reason why we're seeing like these outbreaks is because of they're saying something was wrong. Wait, let me see. I don't want to misspeak, but I just read something before I got on here that they're saying that it's been 40 or more years since all countries ceased routine smallpox vaccines. And then as vaccination also protected against monkeypox in West and Central Africa. And now unvaccinated populations are now more susceptible. So I think that's what's happening because they stopped vaccinating for smallpox. That's why we're seeing outbreaks of monkeypox, because actually the vaccines overlap. So I think this whole thing is going to be short-lived, but you guys do need to protect yourself. And then another thing I wanted to add that we kind of skipped over, wild animals, because this can be transmitted zoonotically. So if you have wild animals that you know are around, make sure if you think the animals have been exposed to the virus, quarantine them from the other animals. And then if you're eating raw meat, and make sure the food is cooked properly, because you can maybe catch
That's true. It can spread with it did say that too. I read that it can spread with you eating animals as well.
And now
I don't eat animals, so I'm good.
Now that it can also spread through arthropods. So if you like to eat crickets and all the other weird bugs and stuff,
behavior, people, behavior.
I'm just saying, it's what I found out. It's not just solely with vertebrates and stuff. It's also bugs. So, and people eat bugs because it's another form of protein. I'm not one of those people, but I'm just saying.
Have a can of beans.
And also, y'all, if y'all have like an animal that you let out periodic, like for me, I have my animals that are indoor animals. They're not outdoor animals. I guess if you have outdoor animals, be aware of that as well, because they could contract something like that and bring it home. If you have a cat that you let out, or a dog, or any other type of animal. Quick question, Dr. Zakia. Do you think people should just get the smallpox vaccine, or what do you think?
I'm thinking that's what they're going to be doing, if I'm to understand this right. Isn't that what they're doing, to giving the people right now?
I'm not sure.
I think what happened was once it was targeted to a specific community, I think they just gave it like monkeypox vaccine. But I think that that's also true, that they will revamp the smallpox vaccine and kind of inoculate it with monkeypox to add the security of making sure that you get less susceptible to contracting it.
And I'm seeing a still newer vaccine based on a modified attenuated
that's what I'm saying.
Approved in 2019, and it's a 2-dose vaccine.
And
it's limited availability. It's limited availability.
I think that they're right now, what I think they're doing is I think that they're vaccinating the community that, men who have sex with men. They're giving them the vaccines first, and they're also giving seniors the vaccines. I was watching Watch What Happens Live with Andy Cohen. I love him. He was on a live, and did you see that one? Every gay guy that went up on his live with him, the first thing he said is, "Are you vaccinated for monkeypox?" So I think in that community, the gay community, they're on it. They're getting their vaccines. They're on it.
That's the next thing besides PrEP. Like, you gotta have PrEP. You gotta have a vaccine for monkeypox. Or
as soon as they went, they were like, "Hey, Andy, what's up?" Andy's like, "Hey, where you call it from? Where, whatever." "Oh, I'm calling from Minnesota." "Oh, you single? Yeah. Did you get your monkeypox vaccine?" "Oh, yes, Andy, we got our monkeypox vaccines." So they know they need to, get that. So,
oh no, I don't want to interrupt you. Go ahead, finish.
Oh no, and the last thing I was gonna say is I also think it depends on, like, for me, being that I live in New York City, I'm usually like whenever something becomes available to me, I get it just because of the density of the population. So I think if it's offered to me, I'm going to take it only because how many people I come in contact with on a daily basis.
Yeah. I just wanted to also mention really quickly a antiviral agent that has been licensed by the EMA, or European Medicines Agency, for monkeypox recently, based on data in animal and human studies. It's not widely available, but it can be used to treat it, and it's called tecovirimat. So there's a drug and there is a vaccine. So besides being socially responsible, watching out for these wild animals, you can, if you do get exposed to it and you need to get treated, you can ask for this drug or see if your insurance will cover it. I'm sure if it's an antiviral, I'm sure it's probably very expensive. These drugs are ridiculously expensive. Yeah. Or you can get the vaccine if you're really like worried about it. You can see if you can, find out from your health department when they're going to get vaccines and get vaccinated when they get them in. Typically, you don't have to pay to get vaccinated. They just give them to you. I've not paid for vaccines like ever. I don't remember ever paying for a vaccine that I got.
That's what's up. Well, I'm not going to keep you guys here all night. Kev, do you have any other questions in regards to this?
Well, first, I want to thank Dr. Saki and Lala because you've taken me off the ledge from a human perspective. But I think, again, over the last 2.5 years, going on to 3 years, we've been very exhausted with things that have impeded our process and the pursuit of happiness, as a lot of people like to say. But I think, again, the key is to think before you do, right? Carry some hand wipes. Wash your hands. Be mindful how you're touching your face. Be mindful if you're eating food without washing. If you're going out to a restaurant, ask for hot water to put your utensils in. If you're at work, don't just sit on the toilet. Use the toilet wraps. And if they don't, go to your owner or the office manager and request that. There's little things that we can do that I know a lot of people don't like to do. But my mother always taught me, think 5 steps ahead. Yeah, it can get exhausting sometimes, but in this day and age, it can save your life or save your loved one's life. So thank you again, Dr. Sakia Lala, for this insight, because I think people need to hear it. And again, as you're out there, go ahead and enjoy yourself, live life, but be mindful of your surroundings and what you're doing.
Absolutely. What y'all doing for the rest of the day? I'm going to the grocery store. I'm starving. What you doing, Kev?
Well, if you're going to the grocery store, bring some gloves to handle the cart. Well, today for me is a prep day for the best team in Radio 9 Lounge outside this group. This is a great team too. And then obviously just staying healthy. I might go run later this afternoon in the heat. That's probably what I'm gonna do. We in a heat wave in New York right now. I'm taking my butt to the grocery store. I'm cleaning up, preparing for tomorrow, work, stuff like that. I'm gonna film another video after this. That's what I'm gonna do, because I actually did my hair and makeup, so I might as well get as much as I can out of this when I look like something. What you doing today, Dr. Z?
Actually, that's a great question. Since you mentioned it, this is a new expansion for me. Like, it's been in my medical practice. I have medical licenses coming in every week. Right now, I'm currently licensed in, I'm about to say Louisiana. No, that's what I'm waiting on. That's where I'm living right now. But California, Michigan, Virginia, and Ohio. So I have maybe 13 more states pending. So today I'm going to work on setting up my front end of my virtual office so people can set up appointments with me.
Awesome.
And, I'll be launching this business along with my hair business next month. So I have a few things I need to work on today. But then
Doc gonna be getting paid.
That's
if you're interested in if y'all interested in Dr. Z's hair care business, check out my podcast. I think it was podcast number 3 or 4 called Respect the Business Owner. Dr. Z displays and showcases her hair care business. So she has a natural organic hair care business, which she's saying the website is launching soon. Deep conditioners, treatments, shampoos, conditioners for natural hair.
Can you help me out, Doc? Can you help me?
Yeah, I can give
and now she's also... She also is doing telehealth visits, and so if you're in any of those states that she's licensed in, definitely hit up Dr. Zakia because she's doing virtual visits, and she has 13 states pending. So definitely check Dr. Z out. Is there anything you want to plug before we go over to Lala?
No, I just want to tell you guys stay tuned. So it will be coming out next month. And I'm super excited. So you guys need shampoo, conditioner, things to treat your hair, make it grow back, or if you need medical help, you need medical help. I'm your girl, and I'm, I guess I feel blessed to be able to, do this, on my own, have my own business and, do it the way that I want to do it. So I appreciate you guys sitting here with me today having this conversation. And
I appreciate you for being here, Dr. Zakia.
Yeah, and just you always supporting. So whatever you do, I'm here.
Thank you.
Will support your show. And I appreciate how much you support the things that I do. And
you know what? Dr. Zakia to me is like Dr. Oz to Oprah. Like, think of me as Oprah, the in-house doctor. Like,
please
Dr.
don't call her Dr. Oz.
Excuse me, Kev. Thank you. Kev is going to be Nate Burris, the gay interior designer to my Oprah. Okay?
I'm not going to be that. But that's
he's not gay. Not that there's nothing wrong with gays.
Don't put that on me. You said
I'm just teasing him. But Dr. Z, thank you so much. You're awesome. Thank you for joining. Thank you for joining me. And of course, you too, Kev. Always down to be my co-host. No matter what type of night he had the night before. I'm gonna ignore Kev's facial expressions there. Check me out though. Yo, I'm actually gonna be on. We're thinking possibly next week. I'm gonna go out to Kev's live broadcast that he has.
You've been saying that for a month.
Damn, put me out there. Nah, for real. I'm going out to his live broadcast next week. Shout out to his whole 950 family. I'm going to be on doing a segment on his radio show. So check me out with Kev and his fam. And Lala, baby, what you doing today, girl? Oh, I almost forgot. Dr. Z is going to be doing live Q&As on her Facebook. Tell them a little bit about that.
Oh yeah. I'm revamping my Instagram and Facebook because right now I'm under Dr. Zakia Antoine, and so I'll be changing my handle to Ask Dr. Zakia. And once a week I'm gonna get on live, and y'all could come and talk with me about whatever it is, or I can have a show focus on whatever people want to ask about that week. It changes, but I get a lot of medical questions from friends, family, just random folk. Lots of people want to ask me about hair loss because that's my passion. But I just think it's great. And then another thing people ask me about sometimes, and we will get into it, is business stuff, because it is a little different being an entrepreneur. And then sometimes people just ask me ratchet stuff. They want to talk about.
And I've interviewed you as a business owner.
Yeah.
I interviewed Dr. Z as a business owner on Ask the Business Owner, not Ask the Business Owner. I'm bugging out. Respect the Business Owner. Make sure y'all check out my episode, Respect the Business Owner, because if y'all tell them everything about business here, they're not gonna watch the episode. Make sure y'all.
Doc is official when she got that little R next to her name. You know that woman's official.
Absolutely. Respect the Business Owner. You can ask her questions regarding business, hair care, and all of that. So Dr. Z, once again, thank you so much. I'm gonna put everybody's information in the description. Lala, go ahead. What you got going on? What you doing today? And what you plugging?
Lala already sipping right now. I got that little glass there.
I'm drinking adult apple juice. My business.
Adult apple juice.
Player.
I'm probably just gonna go hang out with my best friend.
That's awesome. And plug what you got going on with Clubhouse Lala's Lab, and tell them a little bit about what you're doing at work and what you excited for and stuff like that. Because Lala does a lot, and it's very empowering to have African-American biologist on here, African-American doctor, journalist, Kev, radio journalist. This is people who are Black and brown succeeding in life. And these are great examples. And, listen, it's more than just being an athlete, a rapper, a singer in life. You can be a doctor, you could be a lawyer, you could be a biologist, you could be a journalist, you can be whatever you want to be. It doesn't matter where you're from and what color you are. So I like to showcase, African American people who are in position, bosses. Okay.
Angie,
So go
can I
ahead,
say
Lala.
30 seconds? Oh, go ahead, Lala.
I mean,
You
I
can really
don't,
say what you
I
thought.
don't feel that way about myself. I just feel like I'm just really smart and I'm a nerd and I like to pipette things. But thank you. I appreciate it. Yeah, no, I haven't really done Lala's Lab in a while. I've been trying to find something that it will cross both worlds. Like it's not so nerdy and people can understand. And I think this conversation kind of inspired me to just think of like more things to talk about.
Yes.
If
You
need
should do
some
Q&As
throw-
too.
Yeah,
I
if you need some stuff to
probably
throw it
should.
off, reach out. We can definitely help you in that
I'm
area.
just really shy about about things. But really like what's going on at work. I predicted to my coworker. I told her, I was like, this is going to be our new assay, right? Like we're going to be testing this stuff, and she agreed. So I'm just waiting for that ball to drop. But just getting ready for grad school. My concentration is going to be in epidemiology.
Yes.
6. So I'm getting ready for that, and just being a mom and a wife and pipetting things. That's it.
I love that, yo.
Lala, I went to the Tulane School of Public Health. I have a master's in epidemiology. Never worked as an epidemiologist one day in my life, but
It doesn't matter.
I have the degree.
The green wave is in the house.
You know what? I had just real quick, I had a one-on-one with my supervisor, and he was like, so where do you see yourself in the next 5 years or something? And I was like, well, I like it here, but I don't want to stay in like this specific like PCR. I want to do sequencing. And sequencing is like DNA sequencing. So basically like you take a virus and then you find out the genetic code and structure. That's what that is. So I told him I wanted to go into that for quite some time. He was like, why? And I was like, well, because I'm going to be going to school for epidemiology. And he was like, you got it. I was like, yeah. So I'm going to be doing that. I don't know when I'm going to start, but I'm going to be doing that. And I'm super excited.
Continue.
I love that. Congratulations, Lala.
Thanks.
You are so welcome. Thank you guys again so much for
Angie,
being
can I
here.
get 30 seconds? Quick 30
Go ahead.
seconds. Is that possible?
Go
Listen,
ahead.
real quick, and I want to say this because again, I know we're talking about Black excellence and excellence in people in general here. My day job, I work for a company called JustWorks that has a great program in place for entrepreneurs, minority-owned entrepreneurs or women-owned entrepreneurs called the Just Thrive program. So if you're a business, obviously you got to be compliant. These things that Lala and Dr. are talking about are compliance-based businesses. Our company will give you up to $6,000 if you're a new business to start, to get started if you're minority or women owned. So I want to put that out there because sometimes, especially in this economy and inflation, you're trying to get things going. $6K can really kind of, start the wheels going. So anybody has an interest in that or just wants to know more about the program, reach out to me on 950Kev on Instagram. I'd love to show it and share with you. Doctor, and I'm going to talk to you offline. Don't even worry about it. I got you. You got direct process.
I'm going to hit you up because I was just talking
Please do.
Yeah,
please do.
We'll talk. Yeah.
No doubt.
Yes,
no doubt.
I love that. Make sure y'all hit up if y'all need HR services, medical services, grants for your business in regards to what the company can offer if you're a minority or a woman. Make sure you guys hit up Kev. Make sure y'all hit up Dr. Z. Make sure y'all hit up Lala. That's going to do it for us. Thank you guys so much for being here. Kev, thank you for co-hosting.
Having me.
Lala, Dr. Z, friends of the show. Y'all all are friends of the show. Thank you so much for, clearing up the myths and kind of going over everything that you need to know about monkeypox. I hope this helps you. I hope this is your guide. I hope anybody that is nervous about monkeypox or unsure has the information that they need. I hope it did something for you today. As I always say, you could be anywhere in the world, but you could decided to be in Angie's World. And for that, I love you. My name is Angie, aka Angie's World. That's Kev. That's Lala, Dr. Z. And we out of here. Deuces.